Hypersensitivity definition: persistent, misdirected, inadequately regulated immune reactions against a variety of antigens causing tissue injury. Hypersensitivity is persistent, misdirected, inadequately regulated immune reactions against a variety of antigens causing tissue injury. Persistent, misdirected, inadequately regulated immune reactions against a variety of antigen causing tissue injury. Persistent, misdirected, inadequately regulated immune reactions against a variety of antigens causing tissue injury. Classification: four types: type 1, type 2, type 3, and type 4. Type 1 is immediate hypersensitivity, type 2 is antibody mediated, type 3 immune complex mediated, type 4 T cell mediated. Immediate, antibody mediated, immune complex mediated, and T cell mediated. Four types of hypersensitivity: type 1 immediate, type 2 antibody mediated, type 3 immune complex mediated, type 4 T cell mediated. Type 1 or immediate hypersensitivity. Type 1 or immediate hypersensitivity: a rapid immunological reaction occurring in previously sensitized individual. Immediate means rapid. So a rapid immunological reaction occurring in previously sensitized individual. A rapid immunological reaction occurring in previously sensitized individual. Genetic susceptibility and environmental factors like pollutants and microbes play an important role. Genetic susceptibility and environmental factors like pollutant and microbes play an important role. Genetic susceptibility and environmental factors like pollutant and microbes play an important role. Atopy, an increased propensity to develop allergies. Atopy is an increased propensity to develop allergy. Atopy is an increased propensity to develop allergies. Allergen, antigen involved like pollen, animal dander, house dust, and food. Pollen, animal dander, house dust, and foods, these are the allergen. Atopy is an increased propensity to develop allergies. Allergen, antigen involved like pollen, animal dander, house dust, and foods. Pathogenesis of type 1 hypersensitivity. First, exposure. Presentation of the antigen or allergen to naive CD4 plus helper T cells and differentiation of T cells into Th2. Presentation of the antigen to naive CD4 plus helper T cells. Presentation of the allergen to the naive CD4 plus helper T cells and differentiation of the T helper into the Th2 cells. So जो T cells है that becomes Th2 cells. Presentation of the allergen to the CD4 plus T helper cell and differentiation of the T cells to Th2 cells. Th2 cells secrete cytokines interleukin 4, 5 and 13. Th2 secrete cytokines interleukin 4, 5 and 13. Cytokines interleukin 4, 5 and 13. Th2 cell secretes cytokines interleukin 4, 5 and 13. Cytokines interleukin 4, 5 and 13. Interleukin 4. It stimulates the differentiation of B cells into IgA secretin plasma cells and T cells into Th2 cells. So interleukin 4 stimulates the differentiation of B cells to IgE secreting plasma cells. Interleukin 4 stimulates the differentiation of B cells to IgE secreting plasma cells and T cells to Th2 cells. Interleukin 4 stimulates the differentiation of B cells to IgE secreting plasma cells and T cells to Th2 cells. Interleukin 5, it mediates development and activation of eosinophils. Interleukin 5 mediates development and activation of the eosinophils. Interleukin 13, it enhances IgE production and stimulates mucus secretion. ठीक है, TH2 इंटरल्यूकिन 4, 5 और 13 को रिलीज करता है. इंटरल्यूकिन 4, it stimulates the conversion of B cells to IgE secreting plasma cells and T cells to Th2 cells. इंटरल्यूकिन 5 ये eosinophils को डेवलप और एक्टिवेट करता है. इट मीडिएट्स द डेवलपमेंट एंड एक्टिवेशन ऑफ eosinophils. इंटरल्यूकिन 13, it enhances IgE secretion and stimulates mucus secretion. ठीक है, इंटरल्यूकिन 13 जो है वो IgE के प्रोडक्शन को इन्हांस करता है और म्यूकस सीक्रेशन को स्टिमुलेट करता है. IgE binds to the Fc receptor on the submucosal mast cell, that is sensitized mast cell. ठीक है, जो सबम्यूकोजल मास्ट सेल्स का Fc रिसेप्टर्स है उससे IgE बाइंड करता है. IgE बाइंड्स टू द Fc receptors on the submucosal mast cells. ठीक है, तो जो एलर्जन है दैट इज प्रेजेंटेड टू द नेव CD4 प्लस हेल्पर टी सेल. उसके बाद टी सेल का डिफ्रेंसिएशन होता है टू TH2 साइटोकाइंस इंटरल्यूकिन 4, 5 और 13 रिलीज करता है. इंटरल्यूकिन 4 बी सेल को IgE सीक्रेटिंग प्लाज्मा सेल में डिफ्रेंशिएट करेगा. टी सेल TH2 में डिफ्रेंशिएट होता है. इंटरल्यूकिन 5 ईस्नोफिल्स के डेवलपमेंट और एक्टिवेशन को मीडिएट करता है. इंटरल्यूकिन 5 mediates the development and activation of eosinophils. It mediates the development and activation of eosinophils. इंटरल्यूकिन 13 जो है वो म्यूकस सीक्रेशन को स्टिमुलेट करता है और IgE प्रोडक्शन को इन्हांस करता है. इंटरल्यूकिन 13 जो है इट इन्हांसेस IgE production and mucus secretion. Then the IgE will bind to the Fc receptor on the submucosal mast cells. Repeat exposure. Allergen binds and cross-link adjacent IgE antibody. The allergen binds and cross-links with the adjacent IgE antibodies. The allergen binds and cross-link adjacent IgE antibodies. Mast cells release granule contents and produce various mediators. The mast cell will produce granule contents and produce various mediators. Early phase reaction. It occurs within minutes and subsides in few hours. The early phase reaction occurs within minute and subsides in few hours. It involves production of various mediators with edema, mucus secretion and smooth muscle spasm. Early phase reaction, it occurs within minutes and subsides in few hours. It involves production of various mediators with edema, mucus secretion and smooth muscle spasm. Involves production of various mediators, edema, mucus secretion and smooth muscle spasm. Early phase reaction occurs within minutes and subsides in few hours. Involves production of various mediators with edema, mucus secretion and smooth muscle spasm. Mediators and effects. The mediators in the early phase reactions are histamine, leukotrienes, prostaglandin D2, cytokines like interleukin 1, TNF and chemokines. The mediators are histamine, leukotrienes, prostaglandin, cytokines like interleukin 1, TNF and chemokines. Histamine. Increased vascular permeability, smooth muscle contraction and mucus secretion. Histamine causes increased vascular permeability, mucus secretion and smooth muscle contraction. Leukotrienes C4 and D4. Leukotriene C4 and D4 causes bronchospasm, increased vascular permeability. B4 causes chemotaxis. Leukotrienes C4D4 causes bronchospasm, increased vascular permeability. B4 causes chemotaxis. Prostaglandin D2 causes bronchospasm and mucus secretion. Prostaglandin causes bronchospasm and mucus secretion. Cytokines interleukin 1, TNF, and chemokines. Cytokines like interleukin 1, TNF, and chemokines, they promote leukocyte recruitment. Cytokines promote leukocyte recruitment. Late phase reaction. It occurs 2 to 24 hours later and lasts for several days. Late phase reaction occurs 2 to 24 hours later and lasts for several days. Late phase reaction occurs 2 to 24 hours later and lasts for several days. Persistent inflammation without more antigen exposure with recruitment of leukocyte and tissue damage. Persistent inflammation without more antigen exposure with recruitment of eosinophils with recruitment of leukocytes and tissue damage. Eosinophils liberate proteolytic enzymes and proteins which damage tissue. Eosinophils, they liberate proteolytic enzymes and proteins that damage tissues. Late phase reaction occurs 2 to 24 hours later and it lasts for several days. Persistent inflammation without more antigen exposure with recruitment of leukocytes and tissue damage. Eosinophils liberate proteolytic enzymes and protein with tissue damage. Associations with hay fever, bronchial asthma, food allergies, anaphylaxis. Type 1 example: hay fever, bronchial asthma, food allergies, and anaphylaxis. Hay fever, bronchial asthma, food allergies, and anaphylaxis. Type 2 or antibody mediated hypersensitivity. Antibodies like IgG and IgM mediate disease upon reaction with antigens present on the cell surface or on in ECM. Type 2 hypersensitivity or antibody mediated hypersensitivity. Antibodies like IgG and IgM mediate disease upon reaction with antigens present on cell surface or in ECM. Okay. So antibodies, they mediate the disease upon reaction with the antigens that may be present on the cell surface और ECM. सेल सरफेस या ECM पे एंटीजेंस प्रेजेंट होते हैं, उनसे यह एंटीबॉडीज रिएक्ट करके डिजीज़ को मीडिएट करते हैं. Antibodies may be specific for endogenous antigens or for exogenous antigens. Antibodies may be specific for endogenous antigens or for exogenous antigens, chemical or microbial proteins. Okay. Antibodies may mediate cell death, inflammation, and functional abnormality of the cell. The antibody may mediate cell death, inflammation, and functional abnormality of the cell. Pathogenesis, opsonization, and phagocytosis. Opsonization and phagocytosis. Phagocytosis of IgG coated cells. Phagocytosis of IgG coated cells. Antibody mediated complement activation and phagocytosis of the C3b coated cells. Antibody mediated complement activation. Antibody के कारण complement activation होगा. The cell will be coated by C3b और फिर उसका phagocytosis होगा. Association, hemolytic disease of the newborn, autoimmune thrombocytopenic purpura and transfusion reactions. ठीक है. So पहला पैथोजेनेसिस है phagocytosis और opsonization. ठीक है. Phagocytosis of the IgG coated cells. Phagocytosis of the IgG coated cells. दूसरा है antibody mediated complement activations and phagocytosis of the C3b coated cells. एंटीबॉडी मीडिएटेड कॉम्प्लीमेंट एक्टिवेशन होगा. एंड देन देयर इज फैगोसाइटोसिस ऑफ द C3b coated cell associated with hemolytic disease of the newborn, autoimmune thrombocytopenic purpura and transfusion reaction. Opsonization and phagocytosis is associated with hemolytic disease of the newborn, autoimmune thrombocytopenic purpura and transfusion reaction. Hemolytic disease of the newborn, autoimmune thrombocytopenic purpura and transfusion reaction. Okay, opsonization and phagocytosis associated with hemolytic disease of the newborn, autoimmune thrombocytopenic purpura, transfusion reaction. Okay, hemolytic disease of the newborn, autoimmune thrombocytopenic purpura and transfusion reaction. Hemolytic disease of the newborn, hemolytic disease of the newborn, autoimmune thrombocytopenic purpura and transfusion reaction. Hemolytic disease of the newborn, transfusion reaction and autoimmune thrombocytopenic purpura. Second, complement and FC receptor mediated inflammation. Complement and FC receptor mediated inflammation. Complement and FC receptor mediated inflammation. Antibodies deposit in fixed tissues and activate complement and recruit leukocytes. Antibodies कुछ फिक्स्ड टिश्यूज में जाके डिपॉजिट हो जाएंगे जिनके कारण कॉम्प्लीमेंट का एक्टिवेशन होगा एंड ल्यूकोसाइट्स विल बी रिक्रूटेड. Leukocyte activation with engagement of C3b and Fc receptors. Leukocyte activation with engagement of C3b and Fc receptors. Tissue damage with lysosomal enzymes and ROS. Then tissue damage with lysosomal enzymes and ROS. Association good pasture syndrome. So दूसरा pathogenesis है complement and Fc receptor mediated inflammation associated with good pasture syndrome. ठीक है, इसमें क्या होता है, antibody deposit in fixed tissues, activate complement and recruit leukocyte. Leukocyte activation with engagement of C3b and Fc receptors. Then tissue damage with lysosomal enzymes and ROS. लाइजोसोमल एंजाइम्स और ROS के कारण टिश्यू डैमेज होता है. गुड पास्चर सिंड्रोम. कॉम्प्लीमेंट एंड FC receptor mediated inflammation में the antibodies will be deposited in fixed tissues. ठीक है, जिसके कारण कॉम्प्लीमेंट एक्टिवेशन होगा, ल्यूकोसाइट्स रिक्रूट होंगे, एक्टिवेटेड ल्यूकोसाइट्स विल एंगेज विथ C3b and FC receptors. टिश्यू डैमेज होगा बिकॉज ऑफ लाइजोसोमल एंजाइम्स एंड ROS association good pasture syndrome. Third is antibody mediated cellular dysfunction. Antibodies directed against cell surface receptor impair or dysregulate receptor function. Antibodies are directed against cell surface receptors. Antibodies directed against cell surface receptors impair or dysregulate the receptor function. No cell injury or inflammation. ठीक है, तो इसमें कोई भी सेल इंजरी या इन्फ्लेमेशन नहीं होता है. यहाँ पे जो सेल सरफेस रिसेप्टर होता है उसके अगेंस्ट एंटीबॉडीज होता है. दिस इज एंटीबॉडी मीडिएटेड सेल्यूलर डिसफंक्शन. एंटीबॉडी मीडिएटेड सेल्यूलर डिसफंक्शन associated with myasthenia gravis and Graves disease. So type 2 hypersensitivity. ठीक है, इसमें जो एंटीबॉडीज होते हैं दे मीडिएट द डिजीज अपॉन रिएक्शन विद द एंटीजेंस प्रेजेंट ऑन द सेल सरफेस और ECM. Antibodies may be specific for endogenous antigens or exogenous antigens. Antibodies may mediate cell death, inflammation and functional abnormality. Pathogenesis में तीन चीज़ें हैं, opsonization and phagocytosis, complement and FC receptor mediated inflammation and antibody mediated cellular dysfunction. ठीक है, एग्जाम्पल है hemolytic anemia, transfusion disease, hemolytic disease of the newborn, thrombocytopenic purpura, autoimmune thrombocytopenic purpura और transfusion reaction. Complement and FC receptor mediated inflammation का association होगा good pasture syndrome से, or antibody mediated cellular dysfunction associated with myasthenia gravis and Graves' disease. टाइप 3 और इम्यून कॉम्प्लेक्स मीडिएटेड हाइपरसेंसिटिविटी, इसमें एंटीजन एंटीबॉडी कॉम्प्लेक्सेस एलिसिट इन्फ्लेमेशन at the sites of deposition and produce tissue damage. Antigen antibody complex, they elicit inflammation at the site of deposition and produce tissue damage. ठीक है, एंटीबॉडी एंटीजन कॉम्प्लेक्स जहाँ पे डिपोजिट करेंगे वहाँ पे इन्फ्लामेशन होगा और दे विल कॉज टिश्यू डैमेज. The antigen may be exogenous or endogenous. The antigen can be exogenous or endogenous. ये दो टाइप का होता है. सिस्टमिक हो सकता है, सिस्टमिक इम्यून कॉम्प्लेक्स डिजीजेस. ठीक है, सिस्टमिक इम्यून कॉम्प्लेक्स डिजीजेस का पैथोजेनेसिस है फॉर्मेशन ऑफ इम्यून कॉम्प्लेक्स, डिपोजिशन ऑफ इम्यून कॉम्प्लेक्स, इन्फ्लामेशन एंड टिश्यू इंजरी. तो सिस्टमिक इम्यून कॉम्प्लेक्स डिजीजेस में पहले इम्यून कॉम्प्लेक्स फॉर्म होगा, फिर डिपोजिट होगा जिसके कारण इन्फ्लामेशन और टिश्यू इंजरी होगा. So formation of immune complex. Antigen combines with antibody in the circulation to form immune complexes. Antigen और antibody combine करता है और immune complex form होता है. The circulating antigen antibody complexes are deposited in vessels, often affect glomeruli and joints. ठीक है, तो जो एंटीजन एंटीबॉडी कॉम्प्लेक्स है वो वेसल्स में जाके डिपोजिट होते हैं. ये मेनली ग्लोमेरुलाई और जॉइंट्स को इफेक्ट करते हैं. ठीक है, तो ये डिपोजिट हो जाते हैं वेसल्स में एंड दे ऑफन इफेक्ट द ग्लोमेरुलाई एंड जॉइंट्स. इन्फ्लामेशन एंड टिश्यू इंजरी. वंस डिपोजिटेड इन द टिश्यू, immune complex initiate acute inflammatory reaction via complement activation and engagement of leukocyte Fc receptors. ठीक है, थर्ड स्टेप है इन्फ्लामेशन और इन्फ्लामेशन और टिश्यू इंजरी. तो एक बार ये जो एंटीजन एंटीबॉडी कॉम्प्लेक्स है वो जाके डिपोजिट कर जाते हैं. उसके बाद इम्यून कॉम्प्लेक्स दे इनिशिएट acute inflammatory reaction. Immune complex initiate acute inflammatory reaction via complement activation and engagement of leukocyte Fc receptors. तो जो इम्यून कॉम्प्लेक्स है वो डिपोजिट कर गए हैं. अब ये कॉम्प्लीमेंट एक्टिवेशन होगा इसके कारण और इंगेजमेंट ऑफ ल्यूकोसाइट एफसी रिसेप्टर्स के कारण अक्यूट इन्फ्लेमेटरी रिएक्शन इंड्यूस होगा. कॉम्प्लीमेंट एक्टिवेशन और इंगेजमेंट ऑफ ल्यूकोसाइट एफसी रिसेप्टर्स के कारण अक्यूट इन्फ्लेमेटरी रिएक्शन इंड्यूस होता है. Morphology: acute vasculitis associated with necrosis of the vessel wall and neutrophilic infiltration. Acute vasculitis associated with necrosis of the vessel wall and neutrophilic infiltration. Acute vasculitis, vessels में deposit हो रहा है तो acute vasculitis with necrosis of the vessel wall and neutrophilic infiltration. Second is fibrinoid necrosis, smudgy eosinophilic areas of tissue destruction with deposition of ICs, complement and plasma protein. Morphology में we have acute vasculitis with the necrosis of the vessel wall and neutrophilic infiltration and fibrinoid necrosis. Smudgy eosinophilic areas of tissue destruction, smudgy eosinophilic areas of tissue destruction with deposits of IC, complement and plasma protein. So the morphology of systemic immune complex diseases is acute vasculitis and fibrinoid necrosis. Clinical presentation: fever, urticaria, joint pain, lymph node enlargement and proteinuria. Fever, urticaria, joint pain, lymph node enlargement and proteinuria. तो ये मेनली ग्लोमेरुलाई और जॉइंट्स में डिपोजिट करते हैं. तो जॉइंट पेन होगा, प्रोटीन्यूरिया होगा, lymph node enlargement, fever and urticaria. Association: acute serum sickness, SLE, polyarthritis nodosa, post streptococcal glomerulonephritis. So these are example of systemic immune complex diseases. Acute serum sickness, SLE, polyarthritis nodosa, post streptococcal glomerulonephritis. SLE, post streptococcal glomerulonephritis. acute serum sickness, and polyarthritis nodosa. Acute serum sickness, SLE, polyarthritis nodosa, post streptococcal glomerulonephritis. Acute serum sickness, SLE, polyarthritis nodosa, post streptococcal glomerulonephritis. The second is local immune complex disease, that is Arthur's reaction, produced experimentally by intracutaneous injection of antigen in a previously immunized animal. A local immune complex disease, yeah, Arthur's reaction, it is produced experimentally by intracutaneous injection of the antigen. It is produced by intracutaneous injection of the antigen in a previously immunized animal. Acute immune complex vasculitis causes localized area of tissue necrosis, usually elicited in the skin. Acute immune complex vasculitis causes localized area of tissue necrosis, usually elicited in the skin. Okay. Local immune complex disease, yeah, Arthur's reaction, it is produced experimentally by intracutaneous injection of the antigen in a previously immunized animal. Acute immune complex vasculitis causes localized area of the tissue necrosis, usually elicited in the skin. Then T cell mediated या type 4 hypersensitivity. CD4 plus T cells and CD8 plus T cells are involved. So here CD4 plus T and CD8 plus T cells both are involved. Okay. CD4 plus T cell mediated inflammation. CD4 plus T cells secrete cytokines which mediate chronic inflammation and tissue damage. CD4 plus T cells secrete cytokines which mediate chronic inflammation and tissue damage. Yeah, first exposure, naive CD4 plus T cells recognize peptides displayed by antigen presenting cells and secrete interleukin 2, which stimulates the proliferation of antigen responsive T cells. Antigen presenting cells produce interleukin 12, which induces the differentiation of CD4 plus T cells to Th1 subset, and interleukin 1, 6 and 23, which induces differentiation of CD4 plus T cell to Th17 subset. Repeat exposure, the Th1 cell secrete interferon gamma, which mediate macrophage activation. Chronic granulomatous inflammation and tissue damage will follow. Activated Th17 secrete interleukin 17 and interleukin 22 and chemokines, which recruit neutrophils and monocytes. Association, delayed type hypersensitivity, tuberculin test, contact dermatitis, drug reaction, rheumatoid arthritis, and multiple sclerosis. Delayed type hypersensitivity, multiple sclerosis, rheumatoid arthritis. Delayed type hypersensitivity, tuberculin test, contact dermatitis, drug reactions, rheumatoid arthritis, and multiple sclerosis. Delayed type hypersensitivity, tuberculin test, contact dermatitis. Delayed type hypersensitivity, tuberculin test, contact dermatitis, and drug reaction, rheumatoid arthritis, and multiple sclerosis. तो इसमें क्या होता है, CD4 प्लस टी सेल मीडिएटेड इन्फ्लामेशन में CD4 प्लस टी सेल्स दे सीक्रेट साइटोकाइंस which mediate chronic inflammation and tissue damage. Naive CD4 plus T cells, they recognize peptides displayed by the antigen presenting cells. ठीक है, antigen presenting cells पे peptides display होती हैं which are recognized by the CD4 plus T cells. And secrete interleukin 2, which stimulates the proliferation of antigen responsive T cell. Interleukin 2, it stimulates the proliferation of antigen responsive T cell. Interleukin 2 promotes the proliferation of antigen responsive T cells. Antigen presenting cells इंटरल्यूकिन 12 प्रोड्यूस करते हैं विच इंड्यूसेस डिफ्रेंसिएशन ऑफ द CD4+ T सेल्स टू TH1 सबसेट। इंटरल्यूकिन 12 के कारण CD4+ T सेल्स are differentiated to TH1 subset. CD4+ T cells are differentiated to TH1 subset or interleukin 1, 6 or 23 which induces the differentiation of CD4+ T cells to TH17 subset. इंटरल्यूकिन 12 के कारण ठीक है जो CD4+ T cells है they will be differentiated into TH1 subset और इंटरल्यूकिन 1, 6 और 23 के कारण they will be differentiated into TH17। ठीक है इंटरल्यूकिन 12 के कारण CD4+ T cells are differentiated into TH1 subtype और इंटरल्यूकिन 1, 6 और 23 के कारण CD4+ T cells are differentiated into TH17 subset। Interleukin 1, 6 or 23 induces the differentiation of CD4+ T cells into TH17 subtype. Repeated exposure. Okay. ये जो TH1 cells हैं they secrete interferon gamma which mediates macrophage activation. TH1 cells secrete interferon gamma ठीक है और interferon gamma के कारण macrophage activation होता है. Chronic inflammation and tissue damage will follow. TH17 secretes interleukin 17, 22 and chemokines which recruit neutrophils and monocytes. TH1 जो है ये इंटरफेरॉन गामा को सीक्रेट करता है जिसके कारण मैक्रोफेज एक्टिवेशन होता है और TH17 जो है ये इंटरल्यूकिन 17, 22 और कीमोकाइंस को सीक्रेट करता है जिसके कारण न्यूट्रोफिल्स और मोनोसाइट्स रिक्रूट होते हैं। TH17 जो है वो इंटरल्यूकिन 17, 22 और कीमोकाइंस को सीक्रेट करता है जिसके कारण मोनोसाइट और ल्यूकोसाइट्स रिक्रूट होते हैं। एसोसिएशन डिले टाइप हाइपरसेंसिटिविटी लाइक ट्यूबरकुलिन टेस्ट, कॉन्टैक्ट डर्मेटाइटिस, रूमेटॉइड आर्थराइटिस, मल्टीपल स्क्लेरोसिस, डिले टाइप हाइपरसेंसिटिविटी, ट्यूबरकुलिन टेस्ट, कॉन्टैक्ट डर्मेटाइटिस, drug reaction, rheumatoid arthritis and multiple sclerosis. Then last is CD8+T cell mediated cytotoxicity. CD8 plus cytotoxic T cell lymphocytes, they mediate killing of antigen expressing target cells and tissue destruction. CD8 plus cytotoxic T lymphocytes, they mediate killing of antigen expressing target cells and tissue destruction. They mediate killing of the antigen expressing target cells and tissue destruction. Cytotoxic T cells secrete preformed mediators, perforins and granzymes into the target cells, and granzymes trigger apoptosis by activating the caspases. Cytotoxic T lymphocytes, they secrete preformed mediators, perforins and granzymes. CTLs, they secrete preformed mediators, perforins and granzymes into the target cells, and granzymes trigger apoptosis by activating the caspases. Cytotoxic T cells will secrete preformed mediators, perforins and granzymes into the target cells. The granzymes will activate caspases and trigger apoptosis. Granzymes will trigger apoptosis by activating the caspases. Okay. Activated cytotoxic T cells express Fas ligand which can bind to Fas expressed on the target cell and trigger apoptosis. तो टारगेट सेल पे फैस होगा और एक्टिवेटेड लिम्फोसाइट साइटोटॉक्सिक टी लिम्फोसाइट के पास फैस लिगेंड होगा. तो फैस लिगेंड ऑन द CTL will bind to the Fas on the target cell and it will trigger apoptosis. Okay. Example type 1 diabetes, graft rejection, viral infection and tumors. So CD8 plus cytotoxic T lymphocytes का जो हाइपरसेंसिटिविटी है दैट इज़ एसोसिएटेड विथ ग्राफ्ट रिजेक्शन, वायरल इन्फेक्शन, ट्यूमर्स एंड टाइप 1 डायबिटीज़. Type 1 diabetes, tumor, viral infection, and graft rejection.